Hey everyone, my name's Kristen, and this is my microbiology case study. So, my patient was an 82-year-old African American female. She has a history of hypertension, hyperlipidemia, COPD, and breast cancer, which she is now post chemo and radiation. She's also has a history of coronary artery disease, which she has had a coronary artery bypass for. Let's see. Okay, so she is in the ER because she had a history of non-bilious, non-bloody vomiting that day, just 2 hours prior. She had an episode of loose stools. She had developed a worsening shortness of breath, so she's already kind of short of breath because of the COPD. But she could tell it was much worse. She had a fever of 103. Her pulse was 104 beats per minute. She is obese with a BMI of 35, and they found several scratches and several abrasions on her left leg. So they went ahead and did their initial labs. They found that her white blood cell count was 15,500. Her lactic acid was 2.5. Her creatinine was 1.19, and her troponins were negative. So they were a little suspicious of sepsis, and they went ahead and started her on a vancomycin and piperacillin tazobactam through IV. They did some more labs a few hours later, found her lactic acid increased to 5, her creatinine increased to 2.28, and her white blood cell count increased to 27,000. So they'd also did a urine and respiratory cultures, but those grew nothing significant. It was not, they didn't identify anything from that. She became a little hypotensive, and they admitted her to the ICU for possible septic shock. Through the night, she had gone through cardiopulmonary arrest with pulseless electrical activity. They did chest compressions and gave her epinephrine. They did that for about 5 minutes before they were able to bring her back. And once they did bring her back, they intubated her for hypoxic respiratory failure. So she had a long night. The next day, they found her two of her blood cultures had grown, and they grew a non-modal gram-negative rod. It only grew on the blood plate and chocolate, not the McConkey. The organism was a gray non-hemolytic colony. It was catalase, oxidase, and indole positive. So at this point, it wasn't a gram-positive organism. So they stopped the vancomycin. And due to her worsening respiratory status, and they started suspecting a ventilator-associated pneumonia and extended spectrum beta lactamases, piperacillin tazobactam was switched to an imipenem cilastatin. And come to find out, she had septic shock due to Pasteurella multocida. I can never say that word. It kills me. Anyhow, so let's go back to what I said earlier about the abrasions and cuts on her left leg. So apparently her daughter said that she had a cat that died a few days before. And then she brought another cat into the home after that. And they believe that the most likely route of transmission of the Pasteurella infection was through the skin. She was eventually weaned off of the pressors and extubated after 7 days. They repeated the blood cultures. They were negative, but she wasn't out of the woods yet. Her hospital course was complicated by hematemesis, which is just vomiting blood, and ended up leading to aspiration. She had repeated cardiopulmonary arrest and reintubation. And then at that time, she ended up receiving steroids for her COPD exacerbation. She also developed Clostridium difficile colitis and was treated with she was put back on the vancomycin for 14 days. They finally were able to extubate her successfully after 3 days and was treated with imipenem celastotin for a total of 19 days for the Pasteurella bacteremia and possible aspiration pneumonia. She was ended up discharged after 25 days and then sent to a rehab center. So those little cats can cause a lot of problems. Let's be careful out there with those, which is why I don't have one. But yeah, it's kind of interesting, and I thought you guys would enjoy that. Thank you.